Yes, dear colleagues, I do proceed the topic of using 3P medicine in glaucoma. And as we already looked at first two statements in my previous presentation, now I will speak about the algorithms of treatment and monitoring based on well-known pathogenetic mechanisms and individual biomarkers in glaucoma. I want to say that neuroprotective treatment in glaucoma, it's definitely the way of treatment that should be our priority. And when we say when to start this treatment or how long to provide this treatment or what should be the cycle of treatment, I think this is not correct approach. Neuroprotective treatment should start immediately after the diagnosis, and the diagnosis again should be made as early as possible. So why by now yet we do not have any neuroprotective treatment? Because yet the active practice 3D medicine is not yet included into the situation. So now I want to understand, so when we design algorithms of individual treatment, we have to take into consideration very famous pathogenesis of the disease, such neurodegenerative diseases as glaucoma. Actually, many years ago, Klaus Bergoni actually offered this scheme, and according to this, glaucoma damage could be developed both in the high and low pressure ophthalmotone. And the question is whether substances could, the substrate, anatomical substrate, could prevent that, which is damaged in case of glaucoma. And mainly here we see the axons of ganglion cells, because glaucoma is axonal damage first, and everything starts at the level of lamina cribrosa. So lamina cribrosa is the first which is needed at the start, and then ganglion cells, because this process is deferred, so we have therapeutical window of opportunities. On this scheme, with red ovals, I mentioned the factors which are directly related to the vessels, and they mean weakening of ganglion cells and axons due to the insufficient trophism. And we again go back to the importance of vascular factors. But please appreciate, in the basis of everything, we do have stress. We have stress and strain, and that's the basis of any neurodegeneration. So when we see new literature reviews for glaucoma treatment, like shown here in HSS Public Access, so they always emphasize that accent in the future should be made on neuroprotective treatment and the preservation of the mucous circulation in retina and optic nerve head. And as I said before, there is no proved effective neuroprotector agent, not because they are absent. No, in fact, multiple candidates, hundreds of candidates were studied, but there is no evidence-based data. Despite the large number of neuroprotectors in experimental models, but still we don't have the ones proved based on 3P medicine, machine learning, and artificial intelligence. And definitely that's the issue for the future, near future. Well, speaking about circulation of its deficiency, I want to emphasize that important aspect here belongs to astrocytes, because astrocytes and their activation is something that links neurons and vessels in between, because neurons send the signals to the vessels through astrocytes, and astrocytes should save neurons as a result of ischemia in reperfusion, etc., etc. But if it does not happen, or if astrocytes are hyperactivated and release pathological substances, then there is reverse effect. So that's actually defective autoregulation. So how in practice can we judge whether there is autoregulation of circulation in the head or not? Well, the simplest way is to look at spontaneous venous pulsation. It's an indicator of ocular perfusion, and the absence of this pulsation suggests about vascular risk factor for primary open-angle glaucoma. In patients, we rarely see this pulsation because autoregulation is already defective. It was reported that with with the treatment of particular anti-glaucoma drugs, this pulsation can effectively recover, and this is the way how we can restore autoregulation. And mainly it refers to Brimonidine, and such studies were carried out in our country and in other countries. So this is Professor Loskutova group and international publications showing that Brimonidine influencing alpha-2 adrenal receptors can stimulate and promote the production of nitric oxide if needed. So that's very powerful vasodilator. And this is the way how we can improve the circulation and recover auto-regulation of the retinal circulation. And some authors explain by this phenomenon the positive effect Brimonidine compared to Timolol. And this is very famous study of normal pressure glaucoma study, where they proved that with Brimonidine treatment, visual fields were 3 times better preserved versus Timolol effect. Let's appreciate this scheme of potential biomarkers. So this is a very long list. I don't know what could be the correct stress. So let's say biomarkers of optic neuropathy, which reflect pathogenesis. So you see there are multiple factors here in multiple cases. And again, with a red circle, I show you the ones which are related to the fundamental pathogenetic processes of optic neuropathy. And in the basis of that is oxidative stress. So you see antioxidant system shown at the bottom, which is studied. Definitely, we will not be able to talk about hormones. That's another interesting aspect about estrogens and their protective function, but possibly we'll make it next time in our next conference. And now, let's appreciate these fundamental processes in glaucoma optic neuropathy. And now I would like to put together first 3 phenomenon, and this is mitochondrial autophagy, dysfunction, and oxidative stress. So that's one block, and they are closely related in between, and they are consequences of one of the other. We speak about deficiency of circulation. Well, this deficiency mainly reflected to the mitochondrial function and mitochondria of axon, and specifically axons that come from lamina cribrosa of sclera. So as a result of ischemia or vascular dysregulation, we see formation of free radicals. Electrons deviate from their circulation. There are free electrons that are easy to interact with the molecule of oxygen, and then in the recovery of circulation, this phenomenon is called a rare perfusion. So the most dangerous is not ischemia, but rare perfusion with free radicals, with free electrons, and the primary focus is mitochondria of axons. So here you see reactive oxygen species, active oxygen species, and they could provide multiple effects. Well, for example, superoxide anion or hydroxyl radical could interact with peroxynitrite, and then it could kill ganglion cells of the retina. And we showed many years ago at the onset of the disease in the fluid of the patients, there are increased level of metabolites of nitric iron, and then there is a dramatic drop-off of the release that also gives negative effects. But the free oxygen species, they could influence differently. They could stimulate glutamate release, which is needed because it's physiological neurotransmitter. But excessive amounts in the vitreous body and accumulation leads to overexcitation of NMDA receptors on the surface of ganglios cells of the retina, and to each extent it opened the gates for calcium. Calcium gets inside the neuron, and that's why this phenomenon is called the excitotoxic phenomenon or glutamate calcium cascade, because calcium ions inside the neurons create apoptosis, and it goes through a very complicated system and mode of action, multiple cascades, and here you see different stakeholders and players, again, proteins, and again, the most important is pro-apoptotic enzymes are activated, caspase-based, and that leads to the neuronal death. and again, the early events are mitochondria, then it's logical to say that if there are any biomarkers that allow us to identify pathological condition of mitochondria, for example, their depolarization, increased depolarization of mitochondria of axons, that would be the early laboratory test for glaucoma, well, at least indirect, but still laboratory biomarker. Now, redox status or oxidative and reductive processes, they again related to nicotinamide and its derivatives. So it was mentioned that the changed NAD and NADH ratio can be used as a biomarker, early biomarker of glaucoma, and very specific one in this case. Furthermore, if we augment this mechanism via treatment with NAD plus, let's say nanoparticles, which is currently already offered, then that would be extremely effective method for very early stages and the start of treatment. Multiple drugs were offered, and it was offered for mitochondrial dysfunction, ginkgo, vitamin D, nicotinamide I was talking about, B3. Now, interesting studies are carried out in the world, and aspirin, melatonin, resveratrol, green tea, and the list could be very long, and from such well-known drugs like Mexidol.
Just look here. Well, the mechanism of action of Mexidol is very different. First of all, the active form of oxygen, it's an antioxidant. It has an impact on the Krebs cycle. Well, it can be restored. It restores the oxidation processes in mitochondria, which is important in case of neurodegeneration. Recently, we got the information that Mexidol can normalize the mitochondrial dysfunction. That was the study conducted at the Gelngold's Eye Disease Institute. Lymphocytes of the peripheral blood were studied. These are patients who were treated with Mexidol. Another antioxidant is coenzyme Q10 or ubiquinone. That's a powerful antioxidant protecting lipids, DNA lipids from oxidative stress. It prevents the pathological activation of astrocytes, and there might be a very good combination, coenzyme Q10 and vitamin E, which was shown in clinical conditions. This improves the visual functions of patients with glaucoma. Another important combination of use of Q10 with acetylcholine. If you look at this scheme, which was published quite recently, the comprehensive impact on the vision of pathogenesis, CoQ10 and acetylcholine has an impact on neuroinflammation, oxidative stress on mitochondria. It improves the blood flow in combination. Also, the amount of pro-inflammatory cytokines goes down, and naturally, this has the direct neuroprotection. Dmitry is interested in that because we have a common interest here, retina and glaucoma, right? Yes, exactly. It says here retina as well, right? Retinal gliosis. And again, you can see that has a positive impact on everything. And as for brimonidine, well, it has an important action in terms of preserving the internal layers of the retina. There was the ischemia model used here. Brimonidine was shown as a strong antioxidant that reduces the malonaldehyde, increases the protection, such as antioxidant protection, while brimonidine inhibits the accumulation of glutamine, etc. Another drug, brimonidine, is very important. Here is the experiment carried out by the Italian researchers. Dorzolamide is another drug, and it protects the mitochondria from oxidative stress. Again, you can see the model used here. Well, neuroprotective properties of Timolol have been written in literature. It suppresses the excessive presynaptic release of glutamate. Well, and also it has an impact on neurotropic factors. There are some disputable data of Timolol's impact on the blood flow. Well, it may not improve the blood flow, but opinions differ as far as this issue is concerned. I'm talking about the antioxidant properties. And here is our study carried out several years ago on the culture of erythrocytes. We modulated the oxidative stress. Different anti-glaucoma drugs were tested, and you can see Bartholamide has the biggest antioxidative activity as compared to other drugs. And here I would like to present Donzaculin. It's a new generic. In my first presentation, I was talking about pioneer drugs. Right now, we know there are other drugs from this group. group. Darazoft, for example, is one of them, and others. And as for all these drugs, including dorsocalin, they have all the advantages that dorzolamide has in terms of improving the blood flow and in terms of antioxidative activity. Here is one more study, well, a comparative study into antioxidant activity of fixed combinations, and dorzolamide timolol have the highest antioxidant activity. Well, also you can see there are other new generics here, such as shown here. We have a wide arsenal of treatment. The only idea is to understand who should get those drugs. The fixed combination dorzolamide timolol can improve the blood flow. The risk of GON progression decreases by 30 and 20% respectively for each centimeter per second. It increases in diastolic blood flow rate in the ocular artery and posterior short ciliary arteries. That's the neuroprotective activity of these drugs. Well, also, Anaxolite showed that it can be good in improving the blood flow in the optic nerve, and different vitamins were studied as well, such as vitamin E or ascorbic acid. Well, the shortage of vitamin E and vitamin C leads to the progression of glaucoma. These were experimental studies. Another important antioxidant or element which is in short supply in our ration, and in European countries, this shortage occurs at 19 years of age, and there should be a need of the dose of 75 micrograms with the real intake of only 30 micrograms. That's a selenium. But if there is a lot of selenium that can lead to selenium cataract, there are data that selenium can lead to the progression of glaucoma. Well, as for other vitamins, well, there should be a balance achieved, because if there is a shortage or vice versa, too much vitamins, it can be a problem. Omega-3 in the treatment of glaucoma, the shortage leads to the progression of disease. And as for omega-3, it prevents, together with other PUFA, apoptosis through neuroinflammation. Here is another drug which is very well known to you. It's Vitrium Retinom. In the past, it was called just Retinom. This drug has been used in case of AMD, and I would like to say that the deficiency of vitamins and antioxidants in case of glaucoma makes us administer this drug for patients with concomitant pathology and glaucoma in particular, because it contains vitamin E, selenium, and other components, and this drug was developed in conditions close to 3P medicine, because using this formula, artists, well, they tried to reduce atrophy, well, to reduce dry AMD, and 5,000 patients were included in the study. The follow-up period was quite long. It was prolonged because there were some side effects of specific components in the RX formula that was changed, and RX2 was developed, and there was copper, zinc, well, because there were some problems with the urinary tract, well, can cause cancer. Lutein was added, and zeaxanthin, and that's they came with the formula shown here, and you can see Vitrum retinome repeats it, and it has advantages as compared to other drugs of the same group. And again, selenium is here in sufficient concentration. That means this drug can be administered to patients with glaucoma. Well, again, you can see issues related to neuroprotection. You can see, well, vitamin B shortage can lead to Alzheimer's disease. Well, you can see Brimonidine in the treatment of protein in case of misfolding in glaucoma. Well, again, that's the protective action. Also, neuroinflammation is another key aspect. Today, many speakers are talking about neuroinflammation, starting from academician Chereshnev in his welcoming address. That's the global fundamental aspect. Neuroinflammation relates to oxidative stress, also activated astrocytes, so you can see glaucoma and inflammation. They go hand in hand, and the whole range of different biomarkers, which we discussed. First of all, the pro-inflammatory cytokine, well, TNF alpha, its level goes down if Brimonidine is administered. Also, neurotropic factors and neurodegeneration. That's the protective mechanism for axons and ganglion cells, which are weakened. There are different neurotopic factors, but there should be neurotrophic factors and also receptors sensitive to them, such as, for example, receptors on the surface of ganglion cells. In the past, we talked a lot about, well, the growth factor, such as studies conducted under the auspices of Professor Spack on neurotrophic factors. Right now, these issues are very relevant because we have a lot of experimental data. And for example, as for Brimonidine, it can increase the sensitivity of ganglion cells to neurotrophic factors. This is a very important direct neuroprotective action of Brimonidine. And if you look at the scheme, the drug has an impact on all pathological chains. That is why Brimonidine, which we usually use as a hypertensive drug, I would recommend to consider it as a direct neuroprotector first and foremost. We know the original drug alpha-gun or Combigan, the registered combination. We know other drugs which are shown here. Well, again, these are generics, and here is one more generic I'd like to represent to you. That's Biminox, 2 milligrams per milliliter, the concentration of brimonidine tartrate. These are the positive properties of brimonidine shown here, and we can consider this drug for our use in clinical practice. Going back to the growth factor, Neurotech company has registered the implant, which has the endothelial growth factor and receptors sensitive to it. This implant, well, will be introduced into the vitreous body, and the factors, neurotrophic factors, will be released when it is necessary. That means personalized therapy. It is very effective, and the first clinical phase of the trial is over this year. Phase 2 of the clinical trial will come to an end, and this is a very interesting implant. Of course, we recommend our patients use the Mediterranean diet with antioxidants, etc. And in conclusion, I would like to say that neuroprotective treatment should be initiated early and should be continuous. It should be based on the known chains of pathogenesis of glaucoma, but it should be individual and based on individual biomarkers tests. Brimonidine has the greatest evidence base as a direct neuroprotectant, and ICA as drugs that improve retinal blood flow. And apparently, it is advisable to prescribe systemic drugs with antioxidant activity in the complex treatment of glaucoma and concomitant pathology. Thank you very much for your attention.